is going on?
Okay, while he's doing that, I'm gonna start on, just some housekeeping chores. I'm Teresa Latham, and I'm the elementary nurse for those of you who are new, and this is Wanda Littleton, and she's our high school nurse. So a few things that y'all need to know, we have, well, there we go, Kim. You hold this till I get ready to close. I'm trying to break it. Okay, so every student must have a pass to come to the health room. It needs their name on it, your name, the date, and the time. Especially the time, because you never know when these children are going and hanging out in the bathroom, you know, so we need to have an account for the time that they are going from one place to the other. And then the reason they told you they were coming, okay? Because a lot of times they'll tell you one reason and tell us one reason, and that kind of flags that there's a problem, other than why they're coming to the nurse. Only one student should be sent from your class at a time. We can, unless it is an emergency, and if it's an emergency, you should be coming with them or calling us to come. We can only see one student at a time, and these kids do not need to be out of class more than what they have to. If I have a student or Ms. Vonda has a student in the health room, please wait at the door before you come in, because again, that's a privacy issue. The school nursing group will be monitored this year by the state. That was a surprise to us that we found out at Mega, so we're real excited about that. When you call for the nurse to your room when there's an emergency, and Miss Vicki, if you'll help me here, we need to know the child's name, the location, and what's going on with that student. And the reason for that is that child may have an emergency medicine in the health room that we need to bring with us, so that's very important. Miss Vicki, is there anything else you can add to that?
No, just please don't call and go, we need the nurse. That doesn't help.
Yeah, that is probably one of our biggest problems for when the nurse is needed. Field trips. We need to be sure that you can't decide you're going somewhere to the park or to Jack's within a day. We've got to have notice. We have to make a plan for that. And the sooner you can get your field trips into us, the better, because there are quite a few grades that will have to have a nurse. So we've got to get a sub-nurse, and those sub-nurses are very limited. And so if we can plan ahead for them, we can secure our nurse before anybody else does. So that would be a benefit to us. Health plans in Power School. We're going to send you an email that says, please read the health plan on this child. Please go in there and read that plan and mark that box. Neither one of us have time to come and get you to sign that health plan, because you won't go into Power School and mark the box and read that plan. Nor do you want us coming to your room and interrupting your class time. There are some plans that require a signature, and those are like diabetes and seizures, and we'll handle those accordingly, but everything else can be handled in Power School. Also notice that there's the red plus sign in Power School. You can go in there and you can see your child's health issues, which also is where you can see the plan. But that tells you, hey, this child may need to go to the bathroom. Hey, this child may need water in class. You're going to find those details there. You're going to see that child has ADD, ADHD, or asthma. So that's also a very helpful place. Please familiarize yourself with your kids. In your Power School, there should be an area that says student health plans. And I know y'all can't see this paper, but it'll be on the, if you're looking at Power School, it's on the left sidebar. That should let you, where you don't have to go through and hunt and find your plans. It should all be right there, and you can look at them that way. Don't go in and check that box until we have messaged you and said that plan is ready, because our plans are just now being updated for this school year. So you don't want to have to go back and do it again. Anything else on that, Ms. Wanda?
It's good in a timely manner. They said that this year, from this is kind of
again, we don't have time to be sending 1,000 emails about this stuff. Just be aware that there are some school laws, there's an anaphylaxis preparedness law, we're gonna talk about that, backpack, diabetes law, Narcan, seizure, adrenal insufficiency, the LifeVac anti-choking devices, anybody familiar with those? Okay, we have those in our office. Nobody can use those but the nurse. The first line of care is still the Heimlich maneuver, but if somebody is choking, we do have a policy available that the nurse can use that. And it's because it's not FDA approved yet that we haven't got it where anybody can use it. So, all right, now make sure you have signed all of those sign-in sheets. For us, there was a tier 1 sign-in sheet. There is a CPR sign-in sheet, and then you have your main sign-in sheets for Ms. Williamson and Mr. Smitherman. It all has to be in blue or black ink. If it was not, we're gonna be coming back around for signatures, and so I hope that everything you do today is in blue or black ink. That's nitpicky to me, but that's not my rule. Needless to say, I'm not particularly in agreement with that. But I do what I said. Who has the clicker? I know, and I'm scared to use it too. I might break it. Okay, so real quick, undoubtedly we're hearing that COVID is picking up, but we're gonna treat it like the flu and RSV. So basically, you want to make sure you are teaching these kids how to wash their hands, encourage them to use soap and water. You know, hand sanitizer is great between times, but we also need to make sure we're using soap and water. Hand sanitizer does not kill all germs, and we'll go over that a little bit later. I just covered that, you can come back as long as you're fever-free for 24 hours and symptoms are greatly improved. Same way with flu or RSV, or whatever your doctor says as far as returning. Stay home if you're sick, and if you notice somebody's kind of acting like they don't feel so good, get out of their space. So we went over that. All right, just be aware that we have a pandemic plan. Board has it, it's on that site, now I probably won't be able to get back to where I was. All right, I'll keep going. Be sure, vitamin D, get your vitamin D, that's supposed to help the body. Be sure you're eating good food, snack, and getting plenty of rest. Okay, seizures. We have several children in the elementary school with seizures.
I have a few, but I don't have
Mine do have emergency meds. So, there is a medication that is given rectally, that can only be given by a nurse. There are some nasal medicines that people can be trained to give on if it's deemed safe and effective. Always be prepared to do CPR and notice their breathing because a seizure can cause respiratory issues. A nurse or parent must be present for school-sponsored events, including extracurricular activities if DISTAT is at school. And like I said, there's some special situations with the spray, the Valtoco and the Nasalum, and we're gonna watch a quick video for this. This is our tier 1 training. Everybody gets tier 1 training. If you have a student in your room, on your bus, you will get I will send you a link, or Ms. Vonda will send you a link. You have to watch that, print out your certificate. If you have trouble with that site, please let us know so we can get that remedied. It's gotta be something with the website or the browser or the computers, because some people have problems and some people don't. It will give you the option to do the certificate, and we've got to have that certificate in hand.
condition, and it's characterized by recurrent seizures, so more than one seizure, and it is due to abnormal electrical activity or an electrical storm in the brain.
So there are a variety of different causes of epilepsy. Some of them are genetic predispositions, so people who are born with a tendency to develop epilepsy at a period in their life. These are usually syndromes that develop at a certain age. They have certain seizure types associated, may have certain characteristics on EEG, and often have a fairly certain prognosis of whether they will get better and disappear in time or whether they will continue throughout life. There are other causes, such as injuries to the brain that may develop, like a stroke, or maybe a head injury from a motor vehicle accident, for example. There are other congenital causes or reasons you're born with that cause seizures.
So seizures come in a variety of shapes and sizes. Some seizures are very clinically obvious to recognize. So for example, if somebody stiffens and has shaking all over, a generalized tonic-clonic seizure, that's the type of seizure that does not get missed. However, many persons with epilepsy who present with their initial generalized tonic-clonic seizure may have a history of other subtle seizures that were not recognized. And it's important to know the signs of those subtle seizures. Subtle seizures can involve such things as staring, and oftentimes those are mistaken or misidentified as problems with attention or focus. You see children who have absence seizures who will stare, or patients who have focal seizures with impaired awareness who can also stare. Those types of seizures can be more challenging to recognize. And then other seizure types, such as myoclonic jerks, can be mistaken as people being excessively anxious or excessively nervous, or just having the shakes in the morning. And again, those are important to recognize as seizures, particularly if somebody is presenting with a first obvious seizure, because that means that they actually don't have just a first seizure, they in fact have epilepsy.
And when that seizure takes place, again, my arm will just go up for a second or two. Still have my consciousness, but I'm almost staring off, almost like I'm daydreaming. And someone might say something to me, I won't respond because I'm really not hearing them.
I had my first seizure when I was 17 in my high school. I was in a classroom working on the school newspaper, and I got up and fell to the floor and had a tonic-clonic seizure. We thought it was a one-time thing. I went to the ER, we did some tests, but I was basically told we just have to see what happens next. And then I had my second seizure on a high school trip.
I will tend to go into a daze for about 10 to 30 seconds. I'm not able to hear anyone and I'm not able to talk, but usually I come out of it and back to normal.
I have full body convulsions, and when I have my seizures, I'm usually unaware that I'm having a seizure. One of my seizures that I remember very vividly, my first seizure, I tried to talk to let somebody know something was wrong, but I could not speak. But I remember falling over and hitting my head and blacking out.
Some people with epilepsy may have particular triggers that make their seizures occur. And it's important that people with epilepsy make others around them aware of those triggers so we can avoid them in the environment that they're in.
There are common seizure triggers that are present for many individuals with epilepsy, and probably the most common one of those is sleep deprivation. So making sure that you get adequate rest, adequate sleep is really important. For many individuals, stress can also be a seizure trigger. So if there's a lot of emotional stress, mental stress, sometimes a lot of physical stress can also bring on seizures.
My main triggers are stress and lack of sleep. To handle my triggers, I have to make sure that my stress level does not go too high.
So there's a number of steps that an individual can do to help someone who's having a seizure remain safe. One of the first things that you should do is stay with that person, look at your watch, and time when did that seizure start so you know how long it's lasted. The second thing you want to do is make sure that person is safe. So if there's anything dangerous around them, you want to move that away from them. The third thing you want to do is you want to roll them over on their side, and that's because some people can actually vomit during a seizure. You don't want them to aspirate that down into their lungs when they're having a seizure.
These are the main steps for providing first aid for persons having a seizure. Let's look at each step. If you encounter a person having a seizure, stay with the person and start timing the seizure. Remain calm. It will help others stay calm. Always speak in a kind and reassuring tone. Encourage onlookers to move back and give the person room. Ask someone to stay nearby in case further help is needed. Check to see if the person has a medical ID. Look at your watch and time the seizure from the beginning to the end of the active seizure. Timing the seizure will help determine if emergency help is needed. Key concern should be to try to keep the person safe. During a focal seizure, a person may be awake or confused. To keep them safe, move or guide them away from harm. If they are standing or walking, steer them clear of dangerous situations such as traffic, stairs, or train or subway platforms. If a person is falling or has lost consciousness and you are able to reach them quickly, gently guide them to the floor or the ground. Put something soft and flat under their head. Move any dangerous objects out of the way. Make sure nothing is blocking their face and mouth, and that they are breathing normally. Turn the person onto their side if they are not awake and aware. If possible, have their mouth pointing towards the side to prevent saliva from blocking their airway. This helps the person breathe more easily. Try to make the person as comfortable as possible. Loosen any tight clothing around their neck. During some seizures, it may look like the person has stopped breathing when the chest muscles tighten. As this part of the seizure ends, the muscles will relax and breathing will resume normally. Rescue breathing is generally not needed.
One of the most important parts of caring for a person with seizure is to make sure that you don't put anything in their mouth. One of the biggest misconceptions about seizures is that a person having a seizure would swallow their tongue, and that's simply not true. You shouldn't put anything in the mouth of a person having a seizure until they're awake and they are able to swallow. The one instance where it might be okay to put something in the mouth is if they have a rescue medication that is prescribed by their medical team to be given to the mouth to stop it. We don't want to restrain a person when they're having a seizure, so don't hold them down. If they are walking around, you don't need to hold on to them unless they're walking into a dangerous situation, in which case you want to redirect them away from that situation. What's most important here is that we're not trying to make the situation any worse. And sometimes when seizures are over, people can become somewhat aggressive or dramatic. And for these reasons, we don't want to restrain them or hold them.
It is important to stay with a person until they are awake and alert to keep them safe from injury. Most seizures will end on their own within a few minutes. If a person is having any breathing difficulties, call 911 immediately. Be respectful, sensitive, and supportive. Ask others to do the same. Seizures can be frightening for the person having one, as well as for others. People may feel embarrassed or confused about what happened. Keep this in mind as the person wakes up. Reassure the person that they are safe. Once they are alert and able to communicate, tell them what happened in very simple terms. Offer to stay with the person until they are ready to go back to normal activity, or offer to notify someone they want to come stay with them. In some cases, it can be necessary to call for emergency assistance. For example, call 911 if a seizure lasts longer than 5 minutes, or the person is experiencing repeated seizures. Call for help if a person does not return to their usual state after the seizure, or if they have any difficulty breathing. Seizures that occur in water can be more dangerous because a person may inhale some water. Even if a person has recovered after the seizure, emergency help should be called. If the person is injured, pregnant, or sick, or is having a first-time seizure, always call for assistance. And call 911 if the person asks for medical help.
I remember being at church one Sunday at a men's meeting, and I had a seizure, and we're all sitting in a circle, and one gentleman, he got really excited. He didn't know what to do. He jumped up and tried to grab me, and one of the other men who recognized epilepsy said, "No, let him go. We just got to make sure he doesn't hurt himself." So the gentleman over here, he was educated about epilepsy. When people are educated about epilepsy, they will do much better in working with the individual who has the condition.
When I had my first seizure, one of my school nurses did an excellent job helping me to calm down, as I was unaware of what had happen. So she calmed me down. She let me know they had called the EMTs and that they had also contacted my mom and that she was on her way. And helping an 11-year-old scared girl calm down after her first seizure was so important to me because I was able to go to the emergency room unafraid, which was my first ever emergency room visit.
So I think if we summarize all of that information for how to keep somebody safe during a seizure, there's really three things. There's staying with them, there's safe, so keeping them safe, making sure there's nothing around them, and rolling them out to their side. And just by doing those three simple steps, you can really help a person with epilepsy and significantly lessen the risk of any problems as a result of that seizure occurring to them.
Epilepsy is an unpredictable disease, and seizures can occur at any time and any place. And that's why it's important for everyone to be aware of what seizures look like and how to deliver seizure first aid, because you could help save the life of a loved one or a stranger having a seizure near you. To learn more about seizure first aid, visit epilepsy.com.
On the neurology ward, a 7-year-old male called Stefan is brought by his mother. His mother is worried because he's had...
Okay. So main thing is if you have a student who has a seizure, be sure that you look at the clock, you make them safe as you can, don't restrain them. You know, if you've got something you can put under their head, try to do that. Don't put anything in their mouth. Anybody in here from the time of when you used to put things in their mouth? Besides me? Vonda? Yeah, so that's a no-no now. They're not gonna swallow their tongue. That's a misconception. We also have, everybody should have a set of these emergency cards on their backpacks in their room. Coaches should have a set. If you do not have a set, please let us know. These are quick, simple steps in what to do if somebody is having seizures. I think there's Narcan, there's concussion, low blood sugar. So be sure you have a set of these. These are quick, fast instructions on what to do. All right, vagus nerve stimulator. If you had one of these, we would let you know, and we would tell you what to do. We do not have any of those here at Locust Fork as of right now. All right, next, asthma. Probably one of the most common things we have. Be sure that if a child, especially if you're a coach, if a child tells you they have asthma, they are having any of these symptoms, believe them until we prove them wrong. One time, since I have been here in 17 years, I had a student tell the coach that they were having an asthma attack, and they did not have asthma. But the coach did the right thing. They called me, treated it as it was asthma, and the next day I called mom, and we got that straightened out real quick. And needless to say, the whole fella did not do that again. So these are our signs: coughing, wheezing, shortness of breath, chest feels tight. They may not be able to talk as they should. You know, this is getting into an emergency. So if they have an inhaler, all right, you got your inhaler sheet here. Need to pay attention to directions here because we want to make sure this is right. So you have this yellow piece of paper, and it says training and demo. You want to be sure you put your initials in each box. Do not draw lines, do not ditto. Make sure each box beside training and demo has your initials in it. And sign it and date it today. So of course, if a student is in respiratory distress, we're going to call 911 immediately. Stay with that student. If they have the inhaler, they're a high school student, typically they'll be able to do it and give it to themselves. What you may have to do is remind them to wait 1 minute between each puff. The first puff is going to get those lungs started opening up, okay? That second puff is gonna give them more relief, and if they have a third and fourth puff, again, that's gonna give them more relief. But it's important to wait. People tend to want to puff, and that is not gonna help them. That first puff is gonna start opening that airway. Second puff is gonna open that airway even more, and so on. So be sure that they are doing that. Some things you may see. Okay. So Ms. Vonda has got an inhaler there. Typically, if it's the inhaler, they're gonna take a deep breath in, blow it out, put the inhaler in their mouth, push it down, hold their breath for 10 seconds. And I'm just gonna demonstrate this. This is mine, so I'm gonna demonstrate what to do so y'all can get a good idea. Deep breath in, blow it out. Okay, they're gonna hold their breath till 10, and then you're gonna wait a minute and do it again. If they have a mask, if they have a mask that looks like this, the inhaler goes in this end right here. This is what they're gonna breathe in and out of. You do the same thing I just did, except for they'll just breathe in and out 6 times, okay? We have one more mask to show you. It's a little different. It goes over the face like this. Mostly we're gonna see this in little kids. They have ordered it for big kids, but most of the time it's the little kids that are gonna have the mask and the inhalers. So those are important. So be sure that you mark each, like I said, each box on here. Make sure you shake the inhaler. Do the spacer, that's called a spacer, the 2 masks that we showed you. And wait 1 minute, and then if you have to do this with a student, you need to let the nurse know.
Several of our high school students have permission to have inhalers on person on the paper and on that. That's why it's good to familiarize yourself with those. Because unfortunately, this many times there are inhalers, or there's shapes that look like inhalers. So if you see a kid, you're questioning, it may not be your student, so you don't know, you can always come to me and say, hey, I saw this kid, and I can be like, oh, we're good.
So, important to communicate with us. Bus drivers, if you have inhalers on your bus, we're gonna go over those with you specifically. And for each child so that you'll know what to do. Teachers, same thing. If you had a student that has an inhaler that we felt like we needed to go over with you directly, we would do that. Ooh. And I didn't draw that now. Okay, we went over that. PE coaches, be sure that you encourage exercise, but let them self-limit. Exercise is good, we all need it, but it can be an asthma trigger. So you just have to pay attention to the child. We went over that. All right, next, anaphylaxis. That's going to be your red piece of paper. All right, same thing. Initials in the training and demo. Be sure and put your name on here, and be sure and sign it. Be sure that y'all sign these where we can read them so we can figure out whose is whose, because again, you don't have to do this again. We want to do this a one and done. So types of inhaler,
Would it be best, since it's just asking signature on a couple things, to write that's the yellow one, just write our name at the top and print?
perfect, absolutely.
The others have a space for us to write.
Yes. All right, some EpiPens may look like this, where you've got 2 things to twist off. They all have directions on the EpiPen. So look at that EpiPen. Take you a second, take a deep breath. Amanda's gonna run get the EpiPen. We have EpiPens located above, in the elementary, above our AED by the office. Miss Vonda, where is your EpiPen right now? For your office? Okay, outside Miss Davis' office for the high school. Know where those are. we have, they are labeled, you have an adult or a child over 60-ish or 66 pounds, they're labeled. Yellow box, green box is for under that weight, for littles in the elementary. But the EpiPen always goes where? Who knows where the EpiPen goes? In the thigh. You can take this EpiPen, goes through clothes, you push it, it'll click, you hold it, count to 10. Call 911. We have some that talk to you. So far, we have not had any kids with one of these because they're expensive and insurance won't pay for them. But it walks you through the steps. But the same thing, you take it apart, it goes in the thigh. I wish they all did this. Same thing. So it walks you through it. You may see some EpiPens that look like this. Same thing. And bus drivers, if you have these on the bus, we'll go over these more specifically with y'all. If anybody wants more specific, Ms. Vonda's passing some out.
You're too in, right? Yes. I hope so, because I just misspelled your name if you're not.
They also have come out with a new, called a Nexi that is EpiPen, but it is in the nose. So we may start seeing some of those. So far, we've not seen any of those either. Okay. So, you want to be sure that you know they can have swelling of the mouth, itching of the lips and tongue. They may have hives. They may have nausea, vomiting. They may have chest pain. Their heart may feel funny. All these are signs that you would need to give that EpiPen. And giving an EpiPen and it not being needed is better than not giving the EpiPen and wishing you had it. It will not hurt them if they get it. If you suspect an allergic reaction, it is okay to give that EpiPen. Anybody in this room can get that EpiPen. Do not wait on the nurse to get there because you may save that child's life. And I say this because there was a school where something happened. It was kind of early in the morning, but the nurse was there, and they waited on the nurse to get there before the EpiPen whenever somebody else had been doing it. So let's not be on the news because we waited, okay? If they have these signs or symptoms. So things that can cause anaphylaxis, you've got food, medicines, latex, bee stings, exercise. Soy is a food common, peanuts, tree nuts, milk, eggs, shellfish, wheat. Thank goodness we won't have any shellfish around school, I hope, unless somebody brings their own. But any of these things are things that can cause an allergic reaction. And sometimes, that child may have that first reaction here at school. It may not be, we may not know they have the allergy. You can give Benadryl if we have it ordered for the child. And then, of course, the EpiPen, and I've told y'all where we keep them stocked and those things. So we went over this, the directions. There's so many of them. You just got to look at that pen and see whether you pull the top off, but they are very detailed on what you do. And then, of course, like I said, the EpiPen it doesn't matter if the parent says don't call 911, we still call 911. If we give an EpiPen, we call 911. All right, concussion. I know coaches, y'all are good with this, but we have had a few kids that hit their head in the classroom and wound up with a concussion. So, a lot with this is, of course, recognizing it, but also knowing that there may be some things that happen in the classroom after this child comes back, after they've had a concussion, where they may have some changes to their academic day and things like that. Be sure that if you are a coach and you have a child that you suspect has a concussion, that this child does not go back to play until we get a doctor's order. that says they can come back to play. Because, you know, I can't clear them. I don't think the trainer can clear them. I think it has to be, I mean, my understanding is the doctor has to clear them, and we gotta have that note from them. So, of course, we have a protocol, we have to follow our doctor's orders and, you know, whatever we do for them. What we just wanted to be sure we protect this child and that we're not doing things that can cause more harm than, they already have. Okay, diabetes. So, y'all know this is a serious, it's a metabolic disorder. You have type 1 and type 2. They can experience hyperglycemia or hypoglycemia. Hypoglycemia is the emergency. That is a low blood sugar. That is where we're getting into crisis, or where we can get into crisis if we don't do something. So, high blood sugar, things you may see: excessive thirst, frequent urination, hunger, blurred vision, drowsiness, nausea, dry skin. So these children also may not be able to think. They may not be processing what they're learning in the classroom. So if you've got a child that takes a test and they bomb that test, and that's not normal for that child, we need to go back and look at their blood sugars and see if they were high during that time. Of course, we're going to do what the health plan says. These children need free use of the bathrooms. They need to drink plenty of water, so they need water in the classroom. It doesn't need to be sitting out. It needs to be where they can get to it and not have to be getting up 50 times to go get a drink of water. That's disrupting the class, and that's not good for the child. We may encourage them to walk if they do not have ketones. And if they do have ketones, there's some limitations as to what they can do, and we have a protocol for that, as to whether they can participate or not with ketones. The only ketones that they can participate with is if they are trace or if they are small and they are feeling good. And we, of course, would communicate that to you. Low blood sugar, again, the dangerous one. Some similar symptoms to high, but you may have shaking, fast heartbeat, sweating. They may be anxious, they may be dizzy, hungry. Their vision may be funky. They may be weak, fatigued, headache, or irritable. This child may, be disrespectful to you in your life. Where'd that come from? Well, that's probably because they're low. So we need to be getting them checked. You know, I guess y'all have probably heard stories of people getting arrested and them thinking they were drunk, and they really had a low blood sugar, and so that went with that, and issues with that. So we always treat the student, if we don't know if they're high or low, always treat them as low. I'll fix the high later. Make sure they can have some juice, make sure it's not diet. They may have glucose tablets for this. Get them to eat a snack, something with like cheese and crackers, peanut butter crackers, sandwich. 10 or 15 minutes, we're going to check the blood sugar again and repeat the food if symptoms persist. We have emergency medicine for low blood sugar, and this would be given if the child was unresponsive and could not take anything by mouth. If you've got a child and they cannot follow directions to swallow, do not put anything in their mouth because they may choke. And then we also have to make sure we have the student covered on field trips, extracurricular activities and things like that. We cannot make a parent take care of their child. Okay? We cannot insist, we cannot coerce, we cannot, it really has to be their idea to take care of their child. Or we have to word it in a way where that they couldn't come back to us and say, that school made me do this. Because
And for elementary and high school, you thank goodness you don't have to worry about this. The elementary, same thing goes for kids who have accidents. We can't force parents to come up here and change their kid. The only time we call the parent to change their kid is if it's so messy they need a bath, or we don't have any other changes of clothes, those kinds of things. Because that they become our responsibility. That's part of public ed. So I know we don't like to hear that, because we feel like we shouldn't be
not alone with that child doing those things. You know, we should have, even myself, make sure that if you're helping them, you're not by yourself. Okay, Narcan. Blue paper. Only initial the first column where it says, perform skills according to the guidelines. And then be sure and sign it. So, these these devices also look like this. And that extra one laying there, like this. You're gonna put it up in the nostril and push. And it will send the medicine up into the nose. So, I pray we never have to do this, but here we go. So, if they're on an opioid high, you may see relaxed muscles. Speech may be slowed or slurred. They may appear sleepy or naughty. They respond to stimuli. Normal heart or pulse, and their skin color, should be good. We're going to call 911. An overdose, you may see pale, clammy skin. Their speech may be funny. They're breathing shallow. They may be snoring or gurgling. They're going to be unresponsive, shaking to stimuli, to the sternal rub. They may have a slow heartbeat. Their lips and fingers may be blue. They may have small, teeny pupils. And if no breathing, you're going to give 2 rescue breaths, then give 1 breath every 5 seconds and give Narcan.
On that, we're in the process, Mr. Goodman is gonna try to get, if possible, like a little shield, kind of like CCP over the breast. Because you don't know what they call them.
That's what
We're suspecting, so you need gloves.
Just be careful and protect yourself. If you're not comfortable with that, just give the Narcan. Because we don't want to have 2 overdoses, but, you can also, this is just a blurb, Jefferson County Health Department did have a program where you could go onto their website and you could get Narcan that you can keep with you. And, you think, well, why do I need that? Well, you hear of people going to gas stations and things like that and touching stuff. So you might come in contact with it where you didn't even, it's an incidental thing. And, let's face it, a lot of us have family members that, you deal with something with your families where you may need this. So anyway, remove the nasal spray from the box. We have Narcan above, let's see, Ms. Wanda has it. Where do you have it?
Nasal spray.
The high school is with every AED, our AEDs are right now outside the state's office. There is one in here, or around the corner. There is one in Bill's house, in the weight room. There's one in the lobby of the gym. There's one in my office. The only one that does not have Narcan is there is now an AED, because we got several in the school year in the band hall, and I'm working on getting Narcan for that one. So it's there.